Hello, everyone. Pete Schooner here from Ohio Today Magazine and Ohio University's Alumni Association. I welcome you all to our first Bobcats Take Care video chat. Today, we have Dr. Gillian Ice, who's a professor of social medicine and the director of global health at Ohio University. Thank you so much for being here, Gillian.
Thank you for having me.
And I just want to start by just checking in with you. How are you doing? Obviously, there's so much that's changed in the last month to our daily lives. How are you feeling? How are you coping? What's it been like?
I'm doing fine. I was actually in Ethiopia when the university shut down and everyone had to come home. So that was a little nerve-wracking, worrying about getting home and so forth. But my team and I arrived home safely, and then I did the self-quarantine for 2 weeks, and that was a bit challenging. But I actually came in a little bit later before after everyone else had been home. So I'm probably not quite as stir crazy as other people yet.
Sure, yeah, that's an amazing situation, just being a world away there while everything was changing so quickly. I'm sure that was very dramatic. I wanted to, invite you here to be one of our first chats because of your expertise in public health, social health, and to really just ask you, first off, with so many of us doing that self-quarantine, that social isolation, staying at home, wherever we might be, really, can you give us some general insight into why these measures are so important now? Why are we doing what we're doing?
Yeah, absolutely. So, social distancing, as we've been calling it, is one of the most important public health measures that we can take during a pandemic. And we've heard the term flatten the curve, but maybe people don't all understand what we mean by that. And so I want to back up a little bit and talk about there's three primary areas where we mitigate pandemic risk. The first one is preventing it in the first place, and that refers to spark risk. So as we probably all know, the coronavirus jumped from an animal to a human host, and so one of the first things that we want to be doing is always sort of monitoring that potential. So we can't do that now because it's too late. So now we have to do, now that we have it here, what can we do to reduce the spread? And so spread risk and surge capacity are two other things that we look at when we're talking about flattening this curve. So there's several different ways that we can reduce spread. And one of the most important things is just effectively communicating with people what the risk is. So we've seen all kinds of different public service announcements, and the governor and even Ohio University continually reminds people, wash your hands, and the risk of spread and so forth. But there's still a lot of people that don't understand the risk and aren't taking the strategies. Unfortunately, and you may have seen there's been some cell phone data out there that show that Ohio actually is doing pretty well with social distancing. Unfortunately, lots of other places are not. And so one of the things that we need to do is to communicate risk with people. But the reason why we want to stay home, or when we have to go out to stay apart from each other, is because of the spread risk. And you may have heard in the media the term R naught. And what that refers to is how many people an infected person infects. Okay, so if I infect, R naught for coronavirus is around 2, a little bit over 2, we think. And so if I were infected, I would infect 2 people. They would each infect 2 people. And you can see how it would multiply very fast. The way that we stop that is by keeping people who are infected away from susceptible populations. The problem is we often don't know that we're infectious, and so we have contact with people. And one of the things that we know about the coronavirus is that you do spread when you don't have clear signs of infection. And so one of the things that we've seen in real time as this epidemic has progressed is that countries that had very strong and early social distancing orders actually have lower rates of spread than those countries that didn't have those orders. And even in Italy, which we've of course all been watching before it came to the United States, regions of Italy responded differently to the social distancing, and you can see it in their rates of disease. But we're not only social distancing so that we can slow the spread, but also because we know people will become infected, but we also want to reduce the number of people that have severe disease. One of the things we know about this virus is it's highly virulent, meaning it causes severe disease in a lot of people. And so what that happens is we have a surge of patients that have to be hospitalized. So when we talk about surge capacity, it's about making sure that hospitals have the supplies they need in order to meet that increased demand. So by spreading out the epidemic, by not being in contact with people, we give the hospital systems and the public health system a little more time to get those supplies to the hospitals that they need it. And it also reduces that surge. So the number of people that are going to be hospitalized at any one moment actually will be reduced. And so the stay-at-home orders and the social distancing really help the hospitals get what they need, and that they have lower demand. And we saw in Italy, and we're seeing in New York, that hospital staff are having to make these impossible decisions about who gets a ventilator and who doesn't get a ventilator, effectively who lives and who dies. We don't want to put our staff in that situation, right? And really the only hope to keep that from happening is to reduce the demand and increase the supply of personal protective equipment and ventilators. So really staying at home, and when we do have to go out for essential supplies, staying away from one another, and now also recommended wearing masks, is the best way that we can reduce the surge and increase the capacity.
Yeah, sure. That makes complete sense. With the primary focus being just slow it down so that those who are going to be severely affected can get the help that they're going to need and it not be in short supply. So when we look at the virus, what sort of makes it such a unique public health threat? I mean, it's been called the novel coronavirus. So is it that it's new and there's no immunity? Is there something about the way it spreads or its behavior? Is it a combination of these things? What makes it so unique?
It is a combination of those things. So the COVID-19, or the coronavirus, SARS coronavirus 2 is what they call it, is a unique threat. We have not been introduced to it in the human population. A friend of mine actually asked, well, how can it actually be new? It had to evolve from something, and it did, but it evolved from an animal pathogen to a human pathogen. So there were no human populations, that had immunity to it at all. And of course, we have no immunizations that are designed to fight this particular virus. So that's one thing. Nobody had natural immunity to it. And it also does seem to be particularly virulent, meaning that it produces this severe disease easily. So the death rate is relatively high. We don't know exactly what the death rate is. The estimate in Italy, for example, is almost 10%. And part of that is because of just the pathogen itself, but a lot of it has to do with that lack of surge capacity that I just talked about. And lastly, it has to do with the fact that we don't have testing supplies available. So the way that we calculate death rates is by the number of people who died divided by the number of people who are infected. Because we focus all our testing on people who are in the hospital or have real high risk factors, we don't actually know how many people are infected in many places, including Italy. So that death rate will come down just because we'll have a better calculation of it in the future. But if you look at a country like South Korea, where they did population-based testing and they also slowed their curve, their death rate is about 2%. That's still pretty high. And we'll know better in the United States what it'll be once we're able to test more broadly, but right now we can't. So, but the reason why I think that we have to think about why coronavirus became a global threat so quickly is because of that R naught about in terms of we're infecting people rapidly. And we travel as a world so much. We travel across states every day, we travel internationally every day, and we bring our infections with us. And so the nature of society today is such that we're interconnected. And so any new pathogen is a risk. And that's why coming down the line, we have to think about that spark risk and really monitoring and preventing that zoonotic transmission of disease.
Sure. So on that point, I wonder, you're the director of Ohio University's Global Health Initiative. How do you see this crisis? I mean, I think the connections must be clear, but how does it connect to some of the specific work there at the initiative? And how do you see maybe this crisis, the best you can say right now while we're in the middle of it, but how might it change some of the work about around global health and how we view situations like this?
So the Global Health Initiative really has three aspects that we do. So one is to support students from health sciences and College of Medicine to have experiences to go abroad and learn through doing public health and clinical experiences in other countries. The other one is that we do health system strengthening work, where we, right now, what that's entailed is doing research training workshops in different countries. And then lastly, what we do is education of our students. So we have undergraduate, graduate, and master's programs, certificate and classes. The sort of very immediate thing that's changed for us is that all of our students that were abroad or were planning to go abroad, unfortunately, cannot go until the pandemic changes. Our training workshops that we do for health system strengthening are on pause. That's what we were doing in Ethiopia. So we'll shift to some online training and then go back to in-person training as soon as we can. So that's been a challenge. But what we've been able to do is connect with the college's connection with Ohio Department of Health. So we're in the process of getting them ready to help to volunteer for Department of Health, specifically around contact tracing and that risk communication that I was talking about. So it's great that they have an opportunity to develop new skills, but more importantly, of course, that they will help Ohio solve the problem with coronavirus. So that's really great as an opportunity. The way that we teach global health will be affected by this pandemic. This, whether we like it or not, it will be a model for us to teach with. And we'll get to learn everything from success stories, places that did this well and learn best practices. We'll learn where the missteps were. And my hope is that now that we have this experience, we can use it as a tool to teach students to help prevent future pandemics, as well as to mitigate the impact when we do experience them again. So I think the ways that we teach public health and global health will change dramatically after the pandemic is over.
Switching to, I want to check in to see where you're finding hope amid all this. I know it's with the changes to their curriculum in the Global Health Initiative. I know it must be disappointing for you and the students. Obviously, the news can be pretty bleak if you don't look for those bright spots. So just on a personal level, where are you finding?
Where am I finding hope? One of the things that's really impressed me is Governor DeWine and Dr. Acton if you're not already watching the daily briefings, I encourage everybody to do that, because um, they've been doing such a great job at communicating the pandemic, the risks, what we can do to change it. And Dr. Acton was just talking today about actually that the social distancing that we're doing in Ohio is working. And we're still unfortunately going to see deaths. We're still, um, going to be negatively impacted by this. But there's hope in terms of um, not only is it working, but we're learning so much. They've had the hospital systems working together. So to me, it's hope that as Ohioans, as Ohio University students and alumni, we're making an impact, and that this will save lives. And so to me, that's a great, hopeful thing.
Absolutely. Yeah, thank you. So just to wrap up, finally, is there anything you'd like to share with the Bobcat community at large? Any tips you have for staying physically or mentally healthy amid all of this?
Yeah, I mean, the main thing is we all want to follow the advice we've been given by everybody. Stay at home, wash your hands frequently. Um, and I think there's that it does get difficult to stay at home, and we're all dealing with the stresses of this massive quantity of information every day, and struggling between managing children and so forth. And I know the other thing that people are challenged with is stress and depression. So one of the things that I've found is that Ohio University has a great website with resources for faculty, students, and staff. And the Ohio Department of Health, their website, their COVID website, is fabulous in terms of giving tips on how to stay sane, how to stay healthy, even education resources for children. So I just really encourage people to utilize those excellent resources to stay well, because this is difficult for everybody.
For sure. And I just want to thank you so much for taking the time to talk with me and the rest of the Bobcats who might be watching, to give your great perspective and expertise on this. I really appreciate it. Um, on that note of where to go for maybe some positivity, if I could just tell everyone, be sure to check out bobcatstakecare.ohio.edu. There you can find all of the social media messages that Bobcats, students, alumni, everyone in the community have put up just to tell each other, how they're staying well, how they're coping, and giving encouragement to everyone to really just keep in mind that we're all in this together.
Stay well.
Thanks again, and just take care.
Thank you.